Welcome to your vodcast, the Health and Community Services Union, and I'm joined by Des Marcinko right now, HACSU Industrial Organiser. Thanks for joining us.
It's my pleasure, Esther.
We're going to talk about a huge win that happened recently, the HSO review. Tell us, well, first of all, what is HSO? And this is a huge win that came about after 2+ years.
Absolutely. It's a massive win, Esther. So I guess just to start off, HSO stands for Health Services Officer. So these are all of your operational workers that work in Tasmanian hospitals like the Launceston General, the Royal Hobart Hospital, and their occupations range massively. So it encapsulates cleaners, perioperative technicians who work in the theaters, allied health assistants, food services officers. So it captures a whole broad range of different workers.
So what was the review? What were you fighting for? Because I know you were heavily involved in this and so many members as well, who I know you couldn't have done it without. What were you fighting for and why did it take over 2 years?
Absolutely. So I guess just to provide a bit of context, where this all started was an arrangement or an agreement that came out of the last round of public sector bargaining for the PSU-WA. That's the Public Sector Union's Wages Agreement, which negotiates your terms and conditions for the next 3 years as a worker in health. They agreed after the last round of bargaining that they would review the HSO structure. This structure had a lot of issues, right? Because effectively it had been in place for many years. And unfortunately, it was the case that within this structure, you were limited in progressing after a certain number of years. So it was the case that we had, members who are cleaners, who are medical orderlies, perioperative technicians who have been working for the department for 10+ years. However, they were capped out after a certain number of increments, and their vast experience and the skills that come with that wasn't acknowledged. So I suppose what we were trying to get out of this review was a new structure that acknowledges all of those years of service. And in addition to that, a structure that acknowledges a lot of the specialized qualifications that some of our HSO workers have. So for instance, I'm thinking of theatre support officers, many of which have a certificate 3 or 4, allied health assistants who are quite often doing very complex clinical work, who have to have a Cert 3 or Cert 4. So those were the main 2 aims out of the HSO review, was to try to get more years of service recognized, and a couple of those worker groups who have to have certificates, having that be reflected in their pay.
Training that HSO officers have to do comes out of their own pocket. Is that correct?
Yeah, absolutely. So these are workers who, in the first instance, had gone through the process of doing a Cert 3 or Cert 4, just so that they had better skills that they could bring to the workplace, and they weren't even being remunerated for that. So we thought that that was a pretty sorry state of affairs. In addition to that, dental assistants, who are one of the HSO work groups, they had to have a Cert 3 or Cert 4 just to get the job, but yet that wasn't recognized in their pay level. So it was really, really unfair.
So 2+ years, you fought for this with members and, of course, HACSU as well. What were the roadblocks along the way? Because I could only imagine there would have been a lot of pushback.
Absolutely. It was a long, protracted process, but due to absolutely no fault of our own in terms of our members' involvement. It was the case that we were having to deal with a state service management office, and a secretary of health who continually, didn't want to bargain in good faith, who, refused to really, hear out the pleas of our members in terms of, trying to get those years of service recognized and their certificates recognized. So those were the main issues that we encountered, were those individuals that we were bargaining with. There was a case a few months ago where we were offered a new structure, but the department and the government was saying, well, this has to be cost neutral, and this is what you agreed to. We absolutely didn't agree to that. So that was a huge issue when the department actually turned around and gave us an offer on a structure that didn't even include any of those things that we were looking for, which was absolutely bizarre, frankly.
So what was the turnaround? Like, that was just a few months ago.
Yes.
HACSU and your members never gave up.
Absolutely.
So what did they just think, oh, God, it's just give them what they want? Is that what it was? Because 2 months ago it was a totally different story.
Well, unfortunately, it's the case with a lot of these things in the industrial landscape that wins, that pay increases aren't just given. They have to be fought for, unfortunately. So what we had was a scenario where we reached that roadblock in bargaining when the department didn't want to give members anything else. And we had to get our members to take significant industrial action. So what we did is we talked to all the different HSO work groups, from cleaners to perioperative technicians, medical orderlies, ward aides working at Millbrook Rise, Roy Fagan Centre. We got them all together and said, this is what's going on. The department's not budging. What are you going to do about it? And these workers took their destiny into their own hands and said, nah, enough's enough. We're going to take action. So it's the case that I think when we calculated it, we had a couple of instances where we had over 2,000 members taking industrial action. So different work groups implementing their different work bands. And obviously, you can imagine, Esther, that caused a big headache for the department, and they relented pretty quickly after that.
I love that too, because obviously HACSU covering just about every kind of different sector you can in health. You can mobilise all those different sectors to come together like that. That gave me goosebumps, Des. How were you when you found out? You must have just lost your mind.
Yes, absolutely. It was a pretty amazing thing. I had never seen industrial action being taken on such a wide scale. And I think you're exactly right. The really beautiful thing was the solidarity that we saw between these different work groups. You think about a ward aide who works in mental health at Millbrook Rise in New Norfolk, for instance, versus an orderly that works in the theatre at the Royal Hobart Hospital. Really, they have nothing in common as work groups, but they were backing each other in taking industrial action for their collective betterment in terms of their wages and conditions. So it was really beautiful, and it shows the power that when workers stand together, workers across all different fields and sectors, they can get these huge wins.
And it's also harder for government or people in power to pit sectors against each other, which sometimes I feel like happens. Let's talk about what the win was.
So what the win was with this, Esther, is we got to a position where the government presented us with a new structure, the OHO structure, or OHO structure. And within that structure, that includes more increments at the top. So that means that you're not just capped out after 5 years, for instance, but that, your 6th or 7th year might be recognized. So for our long-term members and those who have been working in health for decades, that's a huge win, because there's obviously higher wages associated with those higher increments. In addition to that, we finally got the certificates of those work groups recognized. So it was acknowledged that for theatre support officers, dental assistants, allied health assistants, CSD technicians, and another work group, that if they had a Cert 3 or a Cert 4, they would go over to Band 3, which obviously goes with a higher pay increase. So it was such a relief to finally see, at long last, those work groups with those specialized skills be recognized. Just quickly, another part of the equation was, in the first instance, the department was refusing to just instantly acknowledge those years of service. So they were saying, nah, you'll have to, wait to progress up those new increments, which was really unfair when you're talking about workers who have been working loyally for the department for 10 years, but we're able to get them to come around on a good position with that as well. So that was really positive.
That's amazing. And I know there'll be more information, more in-depth information on the website as well, the HACSU website. When will these changes take effect? When will they be implemented?
Yes, so the government is currently working on drafting the changes to the award, and obviously we'll make sure that they keep their skates on with that, and we'd hope to see those changes be finalized and then go to the commission for registration over the course of the next few weeks.
So what's next? So a huge win, but we also know there's still so many more things to fight for. What's next?
Absolutely, and I'd be remiss not to shout out a few of the amazing delegates that were involved. So for instance, Bill over in the theatre, Matthew over at Millbrook Rise, they did a great job leading workers, getting them to take action, etc. But what's next for health services officers? Well, we're about to go into public sector bargaining. So bargaining for the public sector union wages agreement. Again, that's the agreement that talks about what public sector workers will be getting in terms of their wages for the next 3 years. So we're in a really good position now where we've got those higher wage increases locked in. We've got those certificates, being recognized. Now we're in a position where we'll have to continue to fight for those higher pay increases. Because, of course, we still see the situation where public sector workers in other states still earn significantly more than Tasmanian workers, and we don't think that's okay. But the reality is that we're in a really good position now to carry this momentum over into bargaining to get some great outcomes for our HSO members.
Well, huge win. Congratulations to all the delegates, the members, the industrial organisers. Huge win, but as you say, the fight continues. Thanks so much for joining us, Des.
Thank you so much, Esther.